So today we're going to do the Action II Erbium Laser procedure, and I want to go over the consent with you.
Okay.
So we're doing this to improve fine lines and wrinkles, pigmentation, texture irregularities, vascular dyschromia, and to help with precancerous lesions. So the procedure is going to take approximately 15 minutes, and you're going to have topical on beforehand to numb you. The topical will be on anywhere from 45 minutes to an hour. Okay, the risks of the procedure are there's going to be some discomfort with this procedure, but we found that the discomfort is fairly minimal, and there's no discomfort afterwards. You will have some redness of your skin. The redness will last intensely for a few days, but it will persist for about 2 weeks.
Okay.
There is a risk of pigmentary changes. For the darker skin patients, sometimes we put them on a skin lightener, but in your case, you don't need that.
Okay.
It is possible that you're going to need further procedures to get to your goal, and at that case, we would do it about at least 4 to 6 weeks after the first one. It's very important that you avoid sun exposure for the next month to month and a half, and you should have avoided sun exposure for the 3 weeks prior. There's a small risk of scarring with this procedure, and there's a small risk of having infection with this procedure. If you notice any of these problems, please let us know immediately.
I've started on my antibiotic as you have prescribed.
Perfect. Okay, if there is blistering, we can treat that with topical creams, and it should heal up nicely. You might have a little bit of itching, and that's sort of the normal process of the healing. Ectropion is when the eyelid pulls down slightly, and that's a very low risk in your procedure for you. In patients that have had prior surgery on their eyes, it's more of a risk. We're going to have some acne, possibly, and that's treated with just topical antibiotics. You're going to need to do dressing changes for the next 3, 4, 5 days.
Your nurse has gone over that with me, and she's given me the Zio post-treatment kit to use.
Perfect. So are there any further questions that you have?
No, I don't have any further questions.
Okay, then why don't you sign the consent form? Perfect. So what we'll do from here is we'll take some pictures of you in all different views, and then we'll put some topical lidocaine, which will numb the skin. Okay? Okay? At this point, we are taking pictures with lighting and without lighting, and 90 degrees, 45 degrees, and straight on. And that gives us a good example of what she looks like preoperatively. In our office, you have the ability to find these pictures. This is a Visia photographic analysis, and this analyzes the red and pigmentation in the skin, and it's great to show the differences before and after the procedure. Right now we are applying 23% lidocaine with 7% tetracaine numbing creams. And this will stay on the face for anywhere from 45 minutes to an hour and a half, and then we will wipe it off. It contains something called lipothiene, which allows for a deeper penetration of the lidocaine. The procedure is very comfortable with just this. So what we're going to do is we're going to draw some blood, and this is going to be used for PRP. And so what we're going to do is we're going to put PRP onto the skin after we're done with the laser. And what that will do is it will calm the inflammation and allow the healing time to be decreased. It will significantly improve the duration by a day or two using the PRP. And so we have a system called Megellan PRP, which draws out 60 cc's of PRP of blood. It ends up having 8 cc's of highly concentrated, 6 times the normal concentration of the platelets in the blood. This is unlike others where they draw 10, 12, or even 20 cc's, and you get very low concentration of PRP. So we're just about done here. It takes approximately 15 minutes to spin the PRP, but we'll put it aside and use it later. This is the same PRP that we'll use for hair restoration. Okay, so now we're done. So right here we're spinning the PRP. It's a horizontal centrifuge. It's a little different than most centrifuges. And what it's doing is it's automatically bringing in the 60 cc's of the blood, and it'll spin it out, and it will tell us when it's ready to bring out the PRP, which comes into this. So it's a completely closed system, which is also unusual. So there's a very little risk of contamination, or no risk of contamination. And up here you can set the concentration of the PRP. When you set it to 8 mLs, it's approximately 6 times the concentration. But if you set it to 6 mLs, it will be 8 times the concentration of what's in normal blood. So this again takes around 15 minutes or so to complete. Hi live crew. What we're doing today is we're doing an erbium laser resurfacing. And we're going to do it closely around the eye, so what you need to do is you need to put in corneal shields. So what laser resurfacing is going to do, it's going to improve her ring. So this is a numbing drop that I put in her eye. It's called proparacaine. And it actually works rather quickly. And then we're going to put some drops in her eyes. And those are going to be lubricating drops. I'm putting on sterile gloves right now. She has had numbing creams on for the past 45 minutes, and we've cleaned those off, and we've sterilized her face with some soap, some HIPAA. So right now, we're going to put some drops in her eyes. And these are lubricating drops. It's called Celluvisc. And we're going to put some over here. Good. And now we're going to put some in the corneal shields. And put some in there. Good. And it makes it real lubricated. And we're going to put them into her eyes now. So we bring it down. These might be a little big, but we'll see. Open up your eyes. Sorry. Give me a gauze, please. Good. And now we've got them in that eye. And now we'll put it over here. Give me another. Did you open up another one? Yeah. Okay, open up. Okay, and we're going to put it into her upper lid. You got to open up for me. And now we pull the lower lid down. Okay, so now we've got the corneal shields in her eyes, and that protects her eyes from the laser. And now we're going to start with the laser. Everyone's got their goggles on, right? And we're going to have the smoke evacuator. And she should be pretty numb here. And so this uses a stamping method. And we'll just slowly go around her eyes here. So this is called an ablative laser. Ablative laser means it vaporizes some of the tissues, and it's more aggressive than the non-ablative lasers like Fraxel. So she's going to get 2 passes with this. How are you feeling? Do you feel much of this?
Not really.
No? Yeah. It's usually pretty comfortable. And it goes very quickly. And we need to evaporate some of the smoke, and that's what this is over here. And we're almost done with one pass, and we're going to do the same thing again. Okay, so that's one pass. Now we're going to do a second pass around her eyes. She's doing great. And then we'll get the corneal shields out in a second, and we'll move on to the face. So the healing time for this is approximately 3 to 4 days. And you should note improvements in wrinkles, in pigmentation, in fine lines, and overall texture and tone of the skin. We're almost done here. You see the eyes go very quickly. So this will tighten up the loose, crepey skin around the eyes. That's hard to improve any other way. There you go. So that's the procedure around the eyes, and we're going to do the face in a second. But we got to get these corneal shields out now. Okay, so open up. And that's one. Okay, and then open up again. Okay. And that's two. There you go. So now we got the corneal shields off, and we're going to just place this to protect the eyes for the further treatment around the face. I'm going to turn this over to my PA, Brittany, and she's going to do the remainder of the face. So let's go. She's got sterile gloves on as well. And you're doing fine, hon?
Oh, yeah.
Yeah, okay. So the procedure takes approximately another 15 minutes. And we do 2 passes. And it's a stamping procedure again. So there are 2 different types of lasers that are ablative. There's a CO2 and there's an erbium. And the erbium is less, it's going to cause less coagulation, so there's less downtime, less wound care. A CO2 laser has a lot of coagulation with it, so there's some more dead tissue, so the wound care is more significant. What we do for wound care after this procedure is we do vinegar-soaked gauze on the face every 3 hours. And we put special Zeo post-procedure creams on the skin as well.
It's actually more comfortable than the Fraxel, I think.
Yeah, it is. It's a very comfortable laser.
I mean, I barely feel this.
So she's saying that she feels that this is more comfortable than the Fraxel laser. And that's been our experience with other patients as well. This laser is actually new to the US. It's from Lutronic. And it's also got an attachment to use for vaginal rejuvenation as well. So back to the care afterwards. So for 24 to 48 hours, she's going to be doing the wound care every 3 or 4 hours. And then the skin heals up enough that you can bring that down to a lot less. She's going to be on preventative antibiotics. And today is a Thursday. She should be back to work on Monday. That's been our experience, that it's 3 to 4 days of downtime associated with this procedure. So what you hear is the laser actually double pulsing, and what that does is it allows the laser to go slightly deeper than just the one pulse. Just drip it on, and this mask is sterile, so it's gonna eventually go on top of everything. But we're trying to get this onto the areas that we treated and let it soak in. So after this will be the end, because we leave this on for several minutes and you don't want to see that. But here we go. We're just putting it onto the skin here, and then we'll put some on top. So there we go. So now I'm going to put the mask on. Here you can hold that. And then we'll put some more PRP on. So here we go, this fancy mask here. And now we'll put some more of the PRP on top of the mask. There we go. Okay.
Dr. Weiner, for the people that don't know what PRP stands for.
Platelet-rich plasma. So what you do is you draw blood, and then you put it in a centrifuge. We have a great centrifuge. It's called the Megellan PRP, II PRP System. And it gives you really concentrated PRP. So studies have found that when you concentrate the platelets to 6 times what the normal concentration is, which is 1.5 million per cc. When you do that, that's the maximum benefit of the growth factors from the platelets. So this is what they use for the vampire facelift or vampire facial when they use microneedling. But this causes much better, I think, input of the platelets into the skin by leaving a soaked gauze on the skin for like 15 to 20 minutes, maybe even up to 30. So she has all these little channels from the laser, the erbium, that we created, and now the platelets are going down into them and all their growth factors, and they're going to heal her faster. So let me give you that. So we're just going to let this sit, and she's going to just go into a zone, a yoga zone. Just taken off the PRP mask, and we put on some goggles, and now we're going to do the Healite, and that will that's LED, and that will improve the redness and healing time. And it's a painless procedure that will add complementary to all the erbium procedures. And then you'll see it flash. And it's an 840 nanometer wavelength, and it's optimized for healing. And there you go. All right, this is the final step. She's just completed the Healite, and we're putting on the Palmitrol, which is from the Visia post-procedure kit. And we put it on liberally all over the face. As you can see, she has some mild redness, but she's going to improve significantly faster because we use the PRP as well as the Healite. So she's going to do gauze soaks every 3 to 4 hours at home. And she's going to put it very closely around her eyes where we did the procedure. Right now she's in no discomfort, and now we're going to put on the Revital.
I feel good.
And it's a soothing balm. And we get it all over. And then she'll be able to drive herself home. Notice that we're using sterile gloves for this. And if there's a little bit of blood debris that we needed to remove, and we use sterile gauze for that. So this is as sterile as possible. At home you use Germ-X liberally, and try to stay away from pets around your face. So that's it. How do you feel?
Fine. Ready to
Okay.
head home.
Ready to go home. Here we go.
Hi, my name's Sandy. I'm about 14 hours out from my Erbium Laser procedure done at the Aesthetic Clinique, and someone wanted me to show exactly what I do with my at-home care. So when you're in for your consultation and reviewing consents, we give you the Zio post-treatment kit. We give you some sterile gauze, and we give you some gloves. What I've picked up on my own is a bottled water. I've already had this, but some Germ-X, and then some containers. So what I always do before touching my face is thoroughly wash my hands, and just for double measure, put some Germ-X on. Now with the Zio post-treatment kit, it is very easy to do your home care. And we will go over post-treatment instructions, but right inside the box, it tells you exactly what you'll need to do. So it asks you to mix to get your soaking solution. One of these packets in 12 ounces of water. Since I had a larger bottle, I poured off some of the water and actually added 2 packets. They come in this box, which comes in the post-treatment kit. And what I've done after mixing it, I open my sterile gauze, and I've gotten these containers together, and I pour the solution over the sterile gauze. These 2 remaining ones I'm going to put in my fridge, so it will be more comfortable because it will be nice and cool to do that in the future. This is what I'm going to use right now. In the area where I plan to lay down, I've laid out a towel because these are pretty wet. Our goal is to soften anything on the skin and let it soak for about 20 minutes. So I will use this after I put my gloves on to take off any of the Palmitrol and Revital that I've put on with my previous dressing change. Then I will take this container over, lay down and cover my entire face. You can use your phone as a timer. I want you to soak for anywhere from 15 to 20 minutes. You obviously won't stay with me through that procedure, but when I finish soaking, then I will put on the Palmitrol and follow that with the Revital. So here we go. You just need one of these to take off any remaining. I like to start at the top of my face and work down. This does not hurt at all. I'm gonna put these on for good measure just to show you. My face, the only mild discomfort I had yesterday during the procedure was actually, I would rate the discomfort that I felt about a 0.5% on a scale from 0 to 10, 0 being no pain, 10 being the most discomfort. Last night it felt warm, but I wouldn't describe it at all as uncomfortable. It was hardest for me to try and sleep more upright, but I had a pillow underneath me, a second pillow underneath me most of the night. I do have a pet, and I've avoided that pet. Last thing you want to do is take all these precautions and get your hands and face clean, and then pet that dog or cat. I've been diligent about keeping that pet away from me. Okay, I've got off all the previous Palmitrol and Ribavitrol. Now I'm simply gonna go over to the couch and take this with me and lay down